Let's cross now to Cath Turner. She's at a community health care centre in Buffalo, New York. Cath, what do people there make of this ruling by the Supreme Court?
Well, Darren, I can tell you we're a long way from the Supreme Court in Washington, D.C., but nevertheless there are some very happy people here. This is a community health centre which treats about 13,000 patients a year. Less than 15% of those have private health insurance, and the chief operating officer here told me that every year this centre has to write off about $250,000 in coverage simply because their patients can't afford it. Now that's going to change obviously now with Obama's healthcare law, and I'm here to talk about that a little bit more is Beverly David Lewis. She is the Director of Social Services here at the centre and also works with HIV patients. Thanks for joining us, Beverly. What was your reaction to this legislation being upheld? What does it mean for you and your family?
For me and my family, as a parent, as any parent, as a child is about to go off to college, I think that it will be significant because now our children will be covered with health insurance until they're 26. So children are now going to school longer, they're going to college longer. I know that my son's intentions is to get his bachelor's degree and then go on and get his master's degree. So by the time that's done, he has health insurance the entire time. So we don't have to worry about that additional burden, those additional bills to come in for health insurance, because we never know what's going to happen. So if he's in another state and he gets sick, I know that he is covered.
That's a big relief for you. Were you worried about that up until today?
I was a little worried about that, only because you just never know. I think with kids, you never know. You never know what happens in college. You never know what's going to happen. So anything can happen. I mean, they can get hurt, they can fall and get hurt, they can break something, they can get sick. So it's anything. So I just want to know that my child is covered.
Right, now you work with a lot of patients here, many of whom don't have insurance. How will this change their lives?
Oh my God, it's going to be amazing. The reason why it's going to be amazing, we see a lot of patients. And when the patients come through my office, they're coming for a couple of things. One, they don't have insurance. Number two is that they need medication, or they might need counseling. And we can handle all of that. But it's nice to know that anybody can come in here and we can sign them up for insurance. A lot of people want insurance, they want health care, but they cannot afford it. This will give them the opportunity to be able to afford insurance. And I think for anybody, that's going to be amazing. This is going to be a paradigm shift. For all those people that say, I've been sick for a while, I don't go to the doctors because I can't afford it, they can now afford it. They can now afford it. So I think as a community health advocate, I think that it's going to be important for us to get out and spread the word. I know that I'll spread the word. I know that my staff will spread the word. We have community outreach workers. They're going to be spreading the word. But we're going to really talk to people about how health care is now affordable, how you can come here and be treated for all of those preventable diseases. So for me, it's going to be amazing.
All right, thank you, Beverly. That's the view from the Buffalo Community Health Centre. Obviously, this decision only a few hours old, but it's very clear that this is really going to change the lives of a lot of people here who'll now be able to get that insurance that perhaps they could not afford before.
All right, Cath, thank you for that.